And this afternoon, stocks are up as investors react to news of a tariff agreement between the U.S. and China. Natalie Brand reports.
President Trump is touting a temporary trade deal with China, even as the toughest part of negotiations are still ahead.
The talks in Geneva were very friendly. The relationship is very good. We're not looking to hurt China.
Under the agreement, the U.S. will lower its 145% tariff on Chinese goods to 30%. The retaliatory tariff China imposed on the U.S. will come down to 10% for 90 days while talks continue.
The biggest thing that we're discussing is the opening up China, and they've agreed to do that. But it's going to take a while to paper it. You know, that's not the easiest thing to paper.
Ongoing negotiations are expected to address the U.S.'s nearly $300 billion trade deficit with China, unfair trade practices, and fentanyl.
As long as there is good faith effort, engagement, and constructive dialogue, then we will keep moving forward.
The president also announced this morning a new executive order aimed at reducing the price of prescription drugs by trying to match U.S. prices to what other countries pay.
Basically, what we're doing is equalizing. There's a new word that I came up with, which I think is probably the best word. We're going to equalize.
Experts say the U.S. currently pays roughly 3 times as much as other developed countries.
With this new policy, what we call the most favored nation policy, would mean that the United States would pay no more than the lowest price paid by a high-income country.
The president tried to implement the plan in his first term, but was blocked by the courts. Natalie Brand, CBS News, the White House.
And the pharmaceutical industry issued a statement calling this a bad deal for patients. Drug makers say it could limit access to medications and lead to cutbacks in research for new drugs.